We cross to our reporter, Sentleeng Lehihi. Good morning, Sentleeng. So tell us what is expected. What's on the agenda for today?
Good morning to you and our viewers. We're here in the sunny Sun City on this chilly morning. We're at the 19th annual Board of Healthcare Funders of Southern Africa. In this conference, we saw quite an exceptional opening yesterday where the minister went to length talking about what is to be expected since the adoption of the National Health Insurance, talking about the major amendments that we will see in the Medical Schemes Act. We also saw some stakeholders coming from as far afield as Mauritius to share industry thoughts and motivation and ideas on how to change access to medical health care. What is quite noteworthy about this conference is that its theme is putting the health citizen first. This is actually mirroring what is happening in South Africa now with bringing universal health care to all our people. Right next to me, I've got one of the directors of BHF, Mr. Dr. Doc, can you just outline for us what do we to expect from the coming conference?
No, thank you very much. This conference, as you've articulated, is themed putting the health citizen first. I think for the last few years we've been talking about the changes that need to be made to actually make universal health coverage a reality. So this conference is putting together minds from South Africa and a number of the SADC countries and even speakers from as far afield as the United States to try and help us unravel this conundrum about healthcare coverage and how to increase access, improve quality, and make sure that the cost is not as bad as it is currently.
Doc, this issue of universal health care has had some soothsayers saying that it will be detrimental to the private sector. As coming from the private sector, what do you make of this, particularly being at the forefront of ensuring that you are part of universal health care?
I think the first thing we must acknowledge is that it is not really a choice. Health is a right, is a social right. So we must start from a position of saying there are certain things that we have to do. We need to make sure that people have got access to health care. And we have to examine our current scenario. Are people getting access to good care? Even those who are getting some sort of access, it's not affordable. We've read reports from the Council for Medical Schemes on a yearly basis talking about the escalating cost. So it's not a matter of whether we have a choice of reform or not. It's something that we have to do. So if we examine some of those elements of what you call the soothsayers, saying that it won't be affordable, we do not have capacity. As a Board of Healthcare Funders, we're saying that let it not just be the responsibility of government or that of the minister. We must first examine our own world and say, what are those changes that we can bring to the fore, even before there's a regulatory change? And this conference is going to examine those elements. We are going to have a number of workshops on particular themes around how do we purchase strategically, how do we partner with healthcare providers, how do we partner with hospitals, for example, to bring this healthcare cost down. We also examine some of the things that we know are responsible for escalating costs, things like fraud, waste and abuse. We will have a whole afternoon where we examine this thing and say, how do we curb the scourge of these things that make healthcare difficult to deliver under the current circumstances? And that will also help us to look forward and say, what can we put into place to make sure that universal health coverage becomes a reality?
You do say that this needs the collaboration of all stakeholders, not only leadership. But we saw one of our speakers yesterday say the onus is on leadership to ensure that there is a proper synergy with this program and those who need to get it at the ground. How do you feel about what you have, the working relationship you have with all the stakeholders, particularly government, in ensuring that you go through with universal access?
We're very happy that from a BHF point of view, we've always had access to the National Department, as evidenced by there are quite a number of speakers from the department who are gracing our conference, including the minister who was here yesterday. So we're not just talking about collaboration, but we're living it. We're making sure that we talk to all the role players. So government is an important stakeholder and they are involved. We're also saying healthcare providers. We've got a number of practicing practitioners who are part of the program, and we also want to hear their voice. We also extended a hand to civil society to be part of these discussions, so that the solutions that we are going to put forward in the blueprint that we want to draft afterwards is actually all inclusive, and we have collaboration across board.
Certainly, Doc. Clearly, it seems that the playing ground has widened for all the healthcare funders, particularly in this groundbreaking era of universal healthcare. We'll bring you more on the developments as this conference continues. It will continue until Wednesday. Back to you guys in studio.
Thank you so much, Sentleeng Lehihi, and a very, very important discussion taking place out in the Northwest Province.